thanks to everybody in the campaign who's been working tirelessly in markets and in fairs across Lewisham to gather these signatures. And thanks to Monitor for meeting us, I suppose. And thanks to the people of Lewisham who've given us a clear verdict on the government's approach to the National Health Service. They have eagerly signed these letters. Each letter has been explained personally because who on earth has heard of Monitor? It's a mysterious organisation behind the NHS, and people are very pleased to be able to understand better about what it does. So we want these letters to do a number of things at once. We want to help clinical commissioning groups challenge this automatic procurement by tender. So this is a way in which local groups can cut and break away from the competition challenge that the Monitor has set us. We also want to help campaign groups across the country to involve local people in these essential issues and to strengthen them. And we want to make Monitor to think again about its guidance, because it has the liberty to make things as easy as possible for clinical commissioning groups to do things differently. The rhetoric from ministers and from Monitor itself is that clinical commissioning groups have the freedom to do what they want and to procure in the ways that they want. But the reality is very different. So they are shackled by these guidance, and we want Monitor to change it. There are a number of other messages that these letters send. One is that there is strong anger and suspicion at the Coalition's approach to the National Health Service. People on the streets know that something bad is happening to the NHS, but they have a great deal of difficulty articulating it. And these letters help to do that. So these letters help people make their views known and understand a bit better about the sorts of hidden decisions that are made behind our backs in Whitehall and in the Department of Health and in NHS England. And we are clear from these letters that people reject competition in the National Health Service that so often leads to privatisation. They do not see health as a commodity. Healthcare is not shopping. And actually, we found that people see this approach to competition and privatisation as a form of corruption, that money goes smoothly into the hands of government cronies and corporates. And it goes from the NHS, from our socialised health service, into the corporates, into the pockets of shareholders. These letters also send a message that competition and privatisation do not work. They don't improve health outcomes, they cost a lot, they fragment the NHS, they cut corners, and they are less accountable. This is not the kind of NHS that we want or that will work for patients. And also, competition and privatisation challenge the ethics of care. They change human relationships into financial relationships. And actually we can see these things happening around us over in the last month. The government is constantly telling us that the private sector is the answer, but it's not the answer. Circle, which owns a private hospital, has been unable to make its services pay. Atos is finally going after humiliation after humiliation. We see many examples of private companies in the NHS cutting staff pay and offering services that poorer qualified staff. There's constant criticism from the government about the NHS, and yet we can see that the evidence is that the NHS is actually the best health service in the world. They talk about, and Monitor talks about, a level playing field. There is no level playing field in procurement. It's not a level playing field. Simon Stevens comes from United Health. The General Healthcare Group has Norman Warner, who's an ex-Blair advisor, and Gershon, who's an advisor to Cameron on it. There are lobbyists for Capita, who are run by Cameron allies. This is a network of corruption that people are using to get money from our NHS into corporates. And they tell us that competition works. It does not work. Health outcomes in Scotland and Wales are pretty much the same as England, and competition does not work, does not run there. So, We want these letters to help the people of Lewisham speak or shout directly to Monitor. This needs to change. We reject the privatisation of our NHS. Thank you very much.